This is a great document for trainees, for young people in practice, or people who are interested in getting into especially endoscopic mucosal resection. I think advanced endoscopists who are doing ESD and POEM are very familiar with the different submucosal agents that are out there. But if you're just kind of getting into this and you want to learn about it, you can see in this document the different types of fluids that are available, the characteristics that you might be interested in terms of how long they last, whether the cushion is soft or a little bit firmer, what the contrast agent is that's in the fluid, and also get a lot of helpful tips about how to actually perform submucosal injection, depending on what your clinical goal is.
Yeah, I agree. With that in mind, would you be able to shed some light and maybe highlight 2 to 3 key take-home points from the update?
So I think the first thing is that there's a range of products out there that are available, and they go all the way from our old standbys like saline and hydroxyethyl starch, which are relatively inexpensive, but not quite as viscous and not as long lasting as some of the newer commercially available agents, but which are also more expensive. And in the document, you can sort of learn the pros and cons of these different types of fluids. And then I think, learning about strategies for injection, for example, in the colorectum, if you want to perform endoscopic mucosal resection, where can you inject? Why would you inject with a particular strategy of through the lesion as opposed to at the proximal edge of the lesion, or sort of an inject and resect approach? So those are some of the kinds of things that I think make it particularly useful compared to some other submucosal injection documents. It's just got a lot of practical tips in it.
Yeah, thank you, Dr. Rex. I think for someone starting an EMR practice, as you alluded to, this is really just a nice kind of review paper that's out there to go to review some of these lifting agents and be able to have a readily accessible paper on hand.
Easy to use. There's a nice table in it that will tell you a lot of the features of the agents that are available, and then a nice read through about these practical tips. So agree fully with you, Toby.